Hey there, fellow grad students. Test coming up on electroconvulsive therapy. I have 7 test questions to get you ready. Ready? Let's learn psych fast. Question 1. When the patient asks the PMHNP, how can jolting me with an electric shock possibly do me any good? The answer most reflective of current biological therapy would be A. ECT must sound like a very frightening treatment alternative to you. B. ECT produces a change in the brain chemistry that results in improved mood. Or is it C. ECT interrupts brain impulses that are causing hallucinations and delusions? Or is it D. ECT provides you with external punishment so you can stop punishing yourself? The answer is B. ECT produces a change in brain chemistry that results in improved mood. So current therapy regarding the use of ECT is that the electrical stimulus causes electrochemical changes within the brain, resulting in increased availability of neurotransmitters at the synapses and improvement of mood. To suggest that the treatment is frightening does not answer the patient's question. The treatment is not appropriate for hallucinations or delusions. The remaining option is not appropriate or founded in psychiatric therapy. Question 2. Which statement by a patient just prior to being transported for a scheduled ECT treatment would result in cancellation of the treatment? Is it A. I'll be so glad when this treatment is over? B. Will I remember having this treatment? Or is it C. Did eating some crackers cause any problems? Or D. I'm so tired of being depressed, I don't think I can go on. The answer is C. Did eating some crackers cause any problems? Because the patient is to receive general anesthesia and has orders to remain without food or liquids, the nurse should notify the physician or NP immediately. The introduction of food into the stomach could result in aspiration of stomach contents during treatment. An expression of hopelessness related to depression would be reason to continue the treatment. The other options, they offer no contraindication to treatment. Question 3. You, the provider, has ordered Atropine 0.5 milligrams IM for a patient to be administered 30 minutes prior to ECT. The rationale for use of this medication is that it reduces the secretions and what? A. It protects against vagal bradycardia. B. Improves the scope of convulsive activity. C. Reduces the need for recovery room staff. Or D. Prevents incontinence of bladder and bowel. The answer is A. It protects against vagal bradycardia. So atropine, it's used for its ability to prevent vagal bradycardia associated with the electrical stimulus. The other options are neither relevant nor true. Question 4. Which statement by a patient who has given informed consent for ECT confirms that the patient understands the side effects of this treatment? A. I won't remember the pain. B. It will take several weeks before I feel good again. C. My short-term memory loss will only be temporary. Or is it D. I will be at increased risk of developing epilepsy later? The answer is C. My short-term memory loss will only be temporary. So temporary impairment of recent memory is an expected side effect that occurs to some degree during the course of ECT. The other options suggest that the patient understanding of the treatment and side effects is flawed. Question 5. A novice nurse who will be assessing a patient after ECT asks her mentor, what sort of memory impairment is present after several ECT treatments? The best response for the mentor would be A. It's hard to say. Treatment affects everyone differently. B. Usually the patient has severe difficulty remembering remote events. C. Patients have mild difficulty remembering recent events, like what was eaten for breakfast. Or D. Both recent and remote memory is affected, producing profound, confused cognitive state. The answer is C. Patients have mild difficulty remembering recent events, like what they ate for breakfast. So most patients, they will experience transient recent memory impairment after ECT. The cognitive deficits becomes more pronounced as the number of treatments increases. When the course of treatment is completed, cognitive deficits generally improve to the pre-treatment level. The other options, those are incorrect. Question 6. Which intervention will the nurse implement in the first half hour after the patient has received ECT? A. Continually stimulate the patient to respond and using physical and verbal means. B. Continue bagging the patient to improve respiratory function until patient is responsive for 10 minutes. C. Reorient as necessary to time, place, and person as level of consciousness improves. D. Encourage walking and eating breakfast as quickly as possible. The answer is C. Reorient as necessary to time, place, and person as level of consciousness improves. So patient memory, as I said before, is likely to be impaired in the immediate post-ECT period. Reorientation will be necessary to help the individual return to a functional state. Continual stimulation is not necessary. Bagging is unnecessary. The patient may be allowed to rest and recovery at his or her own pace. Question 7. What milieu factor would need most attention from the nurse who is caring for a patient who has received 6 ECT treatments and has 2 more scheduled? A. Safety. B. Trust attainment. C. Therapeutic activities. Or D. Boundary maintenance. The answer is A. Safety. To feel safe, patient needs to know what is expected of them in their role as patients. The patient receiving ECT often has impairment of recent memory and may become confused about the milieu and expectations. The nurse will need to reorient and reteach the patient with cognitive deficits. So options B, C, and D will require attention, but not to the same extent as safety. All right, thanks for staying with us. Hope you do well on your ECT test. Please share this with your classmates, and if this was helpful for you, please give it a like and subscribe. Thank you. Have a great day.